Dr. Colbey Forman. I'm the Chief Psychoneurologist for the American Board of Psychoneurology and the Dean of the School of Psychoneurology at Beurin University. One of the primary differences in psychoneurology is this concept of learning and creating internal and external learnings versus diagnosis. Diagnosis comes from this process of labeling someone, finding out what's wrong, and then trying to get rid of that problem. What we found in psychoneurology is that the way the brain actually works, it's much more accurate to say that you can add new resources, what we call new resources, to the brain. And that's the fundamental difference in our paradigm. One of the people that we primarily patterned is Dr. Milton H. Erickson. He produced results that were unparalleled in the entire field of psychology. At one point, Dr. Erickson had cured literally 5,000 schizophrenics. And when they interviewed him and they said, Dr. Erickson, how did you cure 5,000 schizophrenics? He said, well, for one thing, there's no such thing as schizophrenia. The concept of the label itself would completely disempower me in helping these people. I worked with 5,000 separate individuals, helped them identify the resources they needed, and because of that, I helped them get those specific resources, and they were quote-unquote cured. If I just looked at the label of schizophrenia, I would have treated them all the same way, and I would have had very, lackluster results. And that's one of the primary understandings in psychoneurology, that each individual can get new learnings, and those learnings will be what give them the ability to have these new skills, and they'll end up rendering those labels completely invalid. Another primary model in psychoneurology is Virginia Satir. This woman was also an amazing genius who is said to have brought together as many as 50,000 families, and was again, another person that we really mark because she produced results no one had ever produced in the field of mental health before. Her concept of diagnosis was that it was completely disabling. She actually says, when I think of the names I call these beautiful people I work with, I hang my head in shame. Basically, when we label patients the way we would physically, a medical doctor who's working with, let's say, a wound, will go ahead and close that wound. They'll negate that issue. Okay, they'll define a pathology and then negate it. But the brain doesn't work that way. The unconscious does not process negation the same way. If I tell you right now, don't think of a white horse or don't think of a rainbow, you pretty much are going to think of a white horse or a rainbow, because the unconscious, the part of our mind that visualizes and makes images, does not process negation at all. So what we really need to do, if I wanted to create a change in you, was rather than saying don't think of a white horse, I would say think of a golden eagle or something like that. That gives your brain something specific to do. Those new processes, those new resources, a direction about how to go that will change you, we call resources. Another example of what a resource will be telling you specifically what to do rather than what not to do. So, for example, if I was working with a patient that was considered suicidally depressed, being an expert on all the stages of depression and the problems that they have, and knowing that the aspects of depression will not be very fruitful in helping that patient produce the change they need. What I need to do is help them be able to make an impression on their nervous system, to use their brain and nervous system more elegantly than they ever have before, and produce consistent results where they can make themselves feel good. And when they have that, we've now negated the concept of this diagnosis of depression, period. Basically, what a learning is a new pattern or a new behavior. So the concept with ADD is very similar. Attention is something 100% of the time we can teach anyone to have attention. We can teach anyone to go into this relaxed state. It's a state in their body that they actually feel. When you go into the specific state, there's this filter between the conscious and the unconscious. It's this semi-permeable membrane, this osmotic shield. It's called the reticular activating system. And it actually opens more when our brainwave state goes down, when it goes lower. When we get into a more intense state, it closes up tighter. Have you ever been in one of those situations where someone's yelling at you and they're screaming at you and you just don't know what to say at that moment? You just have no idea what to say. And then later you leave that situation, and the next day you're thinking about it, and you think of all these brilliant things you could have said, like you could have replied. You're like Perry Mason or whatever, right? What happened is in that moment, because you were in fight or flight, we call it high beta is the brainwave state. In fight or flight, that reticular activating system as a survival mechanism shuts down. So cognitive abilities and getting access to your unconscious and your memories, that all goes away. And what happens in favor of it is you get a shoot of adrenaline or cortisol, and you could run or you could do something like that, but you can't function very well. Sometimes you can't remember your own name. These children or adults who are often labeled with the inability to maintain attention are in a state where naturally all of us are in when we're in a stressed out state, in what we call high beta, in fight or flight. Now, because the unconscious mind works different than the conscious mind, we will automatically find that there are certain patterns that come from that. The understanding we have is that the unconscious works very different than the conscious mind. And the conscious mind is the mind that we have that's of logic, of reason, and it also has negation. You can not think of something, and deduction. The unconscious mind is 88% of your mind. It's the mind that beats the heart, pumps the blood, regulates the body temperature. It's the mind that dreams at night. And we'll come back to this, but if you pay attention to your dreams, you'll notice that things happen in your dream life that don't happen in your ordinary life. And this mind is also the mind that is really what we're looking at for processing change, change in the way we feel. It is the mind of emotion. So emotions that we have and emotional patterns that we have are generated from what we call the unconscious mind. Your unconscious is what you tie your shoes with. For example, when you lean down, you don't anymore say, find the loop, pull it around, or whatever you did when you were a child. You do these things automatically. And the unconscious has a different way of learning. Your conscious mind can learn logically, but your unconscious mind learns associatively. Ayn Rand, the author of Atlas Shrugged and The Fountainhead, is a genius woman, quite eccentric, but a genius, said it best. She said, when I was a little girl, the clock struck and the refrigerator broke, and I learned that clocks break refrigerators. And this is the way our unconscious mind works associatively. And so you can see this is why patterns can play out for a lifetime that don't appear to be logical, that don't appear to make any sense. And individuals can go to therapy for years and years and years trying to remove these patterns logically through talk therapy, trying to figure things out. And they may not always get the results that they're looking for. Unless they introduce a new learning in, it's difficult to create a new pattern. The unconscious doesn't create its own new neural pathways. This is how that would relate to a child who's been diagnosed or labeled with ADD. That child is in a situation where fight or flight or great stress is produced while they're in a learning environment. Perhaps they're reading out loud, or perhaps they're doing something, and then a really negative, painful experience, and that stays with them. The next time that situation comes up, what do you think is going to happen? They naturally are going to go into that same stressed out state, just like all of us. That's the unconscious learning. But at that point, they'll perform less well, and they could go into even more stress. Eventually, there's an unconscious principle called generalization, and it'll start to expand into other things. Now, children that are blessed and gifted with this sensitivity will often feel things even more intensely. I work with a lot of individuals that could be considered rainbow children, and even individuals that are just considered highly sensitive. I'm one of those people myself. And what I say to them is, when you're going to live life with the dials turned up, the colors are richer, it's a more vivid, powerful way to live. But at the same time, if you're going to live that way, like this new wave of children coming out, we're going to need to use our minds and nervous systems more elegantly and more effectively than have ever been used before. Because when we actually direct ourselves, our lives will be richer and more vivid, and these children will have a more vivid understanding and brilliance than we've ever seen before on the planet. By the same token, unless that's guided and directed in a way that's really elegant and much more efficient and effective than has been done up till now, then things that are painful will also be more painful and more vivid and that more powerful. And that could be often why children who don't have the resource about knowing how to bring their attention, how to relax, how to focus, will have an even rougher time because they're experiencing it with even greater intensity. One of the processes that we do is demonstrating for audiences or for even on one-on-ones. I'll often work with a child that's considered to have severe learning disabilities and cannot remember things and has memory impairment and is diagnosed as having this from all kinds of levels. And by actually showing them how to use their mind to link things up, we'll give them 20 random objects in less than 5 minutes. I'll either do it with 1,000 people or even an individual person, and they will know those 20 things in any order. What's 5, what's 9, what's 11, what's 12. And the point of that is to give them a metaphor as well, that when they know how to do something, when they're shown how to do it and directed how to do it, they can do it. In the work that we do, we show anyone, for example, that anyone can learn to concentrate. Anyone can learn to maintain their attention. It's a physical experience in your body, and you have to actually feel it. It's not enough to think something. You actually have to get a sense of this feeling in your body. That's a brainwave pattern or brainwave state of relaxation and concentration. We call it the alpha state. So that state can be maintained and regulated by anyone if they're shown how. There's primarily 4 brainwave states. They're delta, theta, alpha, and beta. Delta is deep sleep, and it's often used to regulate brain chemistry. That's when our brain chemistry often can get regulated and kind of centered back into a focal point of balance or homeostasis. Coming up from delta, from deep sleep, we have the theta brainwave state. Deep meditators can go into the theta brainwave state, but generally we associate it with dreaming, rapid eye movement, and that kind of thing. And it's often understood that dreaming kind of helps us balance emotional chemistry as well. So it's a different place for healing and balance. And again, very deep meditators and certain healers can go into the theta brainwave state and will as well. Moving up from there, we have the alpha brainwave state, and that is a state of relaxed, focused concentration. That from that state, that's the state where you just feel relaxed and good. Television is an alpha producing machine. When you're really 100% there with the person you love, or you're reading a book and you're fully engaged in that, that's alpha. That's the alpha brainwave state. And children tend to be in the alpha brainwave state far more than adults. Moving up from that state, and I want to say one thing, in each state we move up, this filter, this osmotic shield between the two brains, the conscious and the unconscious, tends to shut tighter and tighter. When we get up to the state called beta, we're thinking of something that we now think of as divided attention. It's interesting, a lot of times when we're trying to be more focused, we think what we really need is more brain power, more, a faster cycling into our brain. But in actuality, we need to move our brain patterns slow enough that all the attention and direction could be focused in one direction. Beyond a certain point, it's too much and the brain pattern has to split. And that's beta. Now we're living in beta most of the time as adults. You're driving down the highway, you're gauging your speed, you're wondering what that sound is behind you, you're seeing if there's a police officer in the rearview mirror, and maybe you're even thinking about the meeting you're going to and what you're going to say. That's the state of divided attention, and we're thinking of 5 to 7 plus or minus things at that time in high beta. High beta is a great state to be at when you're driving. It's not the state you want to be in while you're trying to focus or be at one pointed or be there present at that moment. From beta, we can even go into high beta, which is just really stressed out, fight or flight. And that's the state I told you about, where perhaps you're in an argument with someone and they're yelling at you and you can't think of anything brilliant to say at that moment. So children that are identified with the beta brainwave state are the ones we're often labeling as having a disorder, that they can't focus their attention. A new term came up called hyperfocus, which was, these children are in hyperfocus, which from our understanding is literally that it feels so good. Like I said, remember that alpha is actually a feeling in your body, and it feels so good to stay in that feeling. But once you get there, if you have a hard time getting there, you'll do everything you can to remain there. And that's really what we call hyperfocus. So a lot of children, when they're in a learning environment where they start to get stressed out, where they're yelled at, or they go into some fight or flight state, and they have this negative experience. Remember I said the unconscious learns by association. So that association to feeling bad or feeling stressed out while reading sticks. And the thing about the unconscious is it learns from one time. Phobias are what we say are examples of one trial learning, one-time learning, which means basically a child or an adult can have an experience with, let's say, a dog barking at them or something that terrifies them, or maybe they're bit. And that's so painful that next time they see a dog, what do? They go into fear. So learning occurs with the unconscious, basically in this associative pattern. Often when a child goes into a learning environment, they might have an experience that is very stressful. I don't know if you ever remember, but reading in front of the class or certain other situations can become very tense and very stressful, particularly for these children we're talking about that are truly, like we said, the dial is turned up in their life, in their heart and their emotions. So they can experience this with great vividness. Well, remember, the unconscious works associatively. So the very next time they go back to that reading experience, particularly if it didn't turn out so positive, they will have this fight or flight. They will have this state of high beta, and the reticular activating system will be kind of shut. It'll be hard for them to think. It'll be hard for them to process. And at that point, they'll be less effective. And can you see how that could create a downward spiral? So our solution for this basically is helping recondition. And conditioning is just another word for the way the unconscious works. Basically helping create experiences where they can be relaxed and focused and bring that resource consistently over into those environments. When we do that, we see that these children go from being labeled with something like ADD to being labeled as brilliant. And this happens, we see this consistently every day in my practice and our practice at BU.